We're talking to a terrific panel here about the problem with prescription drug abuse in America. Donna Dentz, the Assistant Director of the Office of Behavioral Health Prevention. Dr. Liza Chapman is President of the Georgia Pharmacy Association and Clinical Manager at Kroger. And Dr. Susan Blank is an addiction psychiatrist and clinical co-chair of Think About It. The real focus in the news lately has been the opioid epidemic. But that's a symptom of a larger problem, prescription abuse. Talk about the scenario of overdose. How do you get into trouble in an overdose situation?
Well, I think that can happen from a variety of ways. First of all, I think most of us think about the person with the disease of addiction who's using the medication either in a recreational way, and I'm using air quotes for that, or they're using it because they have the disease of addiction. But that's really not true. Many people can take a medication for the first time and have a bad reaction to it and get into an overdose problem because of their own chemistry, but also maybe because of other medications that their physician may not know that they are also taking. Sometimes we see kids getting the medications. The pills are bright colors. They unfortunately are curious, and they want to try to take that too. They see mommy taking it, must be good for me. So there are a variety of ways that it happens to regular people not intending to do anything but take medicine as they think they're supposed to. And it can be lethal and they can die.
Anything to add to that?
So one thing that I just would like to point out from the pharmacist's point of view, it's very important for patients to have a updated list of the medications that they're taking. So if you're going to multiple physicians or you're going to multiple pharmacies, that you can share that information with the provider so that we can be able to determine if there's an interaction, you're on the appropriate dosage, or you're at risk for an overdose, and that we can assist with that process.
Yeah, I would think that a situation you might get in, especially with a family member, let's say a family member winds up in an OD situation, you might be hesitant to get those people in trouble by calling a doctor or calling 911. Speak to that, would you?
Well, Georgia does have a Good Samaritan law, which offers amnesty for someone who calls because they're with someone who's overdosing, even if they have the paraphernalia around and they were there with them. If you call 911 and you stay with the person and help them get help, there's an amnesty law that helps protect charges being brought against you. So that's the best thing to do, is stay with them and call 911. We're actually beginning to run a series of PSAs around that issue to help everybody be aware that they can do that and they should do that, and don't be afraid to call 911.
And as far as yourself is concerned, let's say you wind up feeling bad. When should you say, okay, I got to get some help?
You know, if you're just feeling lethargic, having difficulty breathing, just knowing what those signs and symptoms of overdose are. But definitely the difficulty breathing is probably one of the first signs and symptoms you would see.
Big one, isn't it?
It's a big one. And if you're watching someone, you may look and see that their pupils, rather than being the normal size for the room and the light in the room, their pupils are becoming really small, and they're seeming to not be with you in the sense of answering your questions and responding appropriately. They're very likely something's going on, and an overdose may be exactly what that is. So much better to be safe than sorry. Call 911. Don't risk someone's life because you're afraid.
One of the ways we're trying to address it as well is within Georgia and the Office of Behavioral Health Prevention, we received a grant recently also to provide training and education with first responders and with community persons on the use of naloxone, which is to help reverse overdoses. And a lot of the first responders are beginning to use those to try and deal with this.
Is that a good drug, naloxone? I mean, does it work?
It's the best thing to reverse overdose.
Wow. So it jumps in there. Well, what does the drug do, Doc?
Well, what it does is it attaches very tightly to the little receptors in your brain that the opiates have attached to and are having action. And that kicks the opiate off and it allows the patient then to resume breathing and to become conscious. It's pretty dramatic when it happens. They can be completely not breathing, completely unconscious. And you administer even a single dose of this medication, and within 30 seconds, you have a person back with you again.
It's that
You've
quick.
saved a life, yes.
Has a very short half-life
How about that?
mechanism of action.
Yes, it acts.
And if I'm not mistaken, at least in the state of Georgia, there are new programs to get more of it out there.
Yes.
The state legislature has just passed some things to make that happen.
Yes.
So, Scott, this past December, Governor Deal passed an emergency order that allowed neighborhood pharmacies to be able to dispense naloxone to patients and first responders requesting the drug.
Or family members.
Family members.
Without a prescription, you can walk in and you can ask your local pharmacist for the kit, the medication itself, and for information about how to use it and directions to YouTube videos. I know our Think About It campaign has a wonderful video that Dr. Tennant Slack worked on that shows an overdose situation, how to respond. 911's the first thing you've got to always do. Then administer the medication, then do breathing for them if they still haven't come around.
So this is really the big leaps forward just in the past year or two here.
Absolutely.
Yes.
And the important thing to remind everyone, this doesn't affect one geographical area of our state or one demographic. It affects us all. So the highest of educated people to folks that don't have education, it's affecting everyone. So just want to remind everyone of that probably you probably know someone that's affected by prescription drug abuse. Maybe not you directly, but you know someone who knows someone.
Thank you for joining us today. Our terrific panel trying to get to the root of the problem of prescription drug abuse and giving you some real tools on what to do about it. The Georgia Crisis Line, the number is available on your screen. The Think About It program will make that resource available to you as well. Use them. Talk to the people who know you best in the health provider community. And thanks again for joining us today. We hope we gave you something that will help. Be healthy.